EMT versus paramedic. What's the difference? One of the most common questions people ask in EMS is what's the difference between an EMT and a paramedic? And honestly, a lot of people think they're basically the same job. But while EMTs and paramedics work together constantly, their training, responsibilities, scope of practice, and medical capabilities are very different. In this video, we're breaking down EMT versus paramedic, what each provider actually does, and what new EMS students need to understand. Let's get into it. EMS is a team system. First, understand this. EMS works as a team system. Different certification levels provide different layers of emergency care, and both EMTs and paramedics are critical parts of that system. This is not what it's about. Who is better? It's about different training levels, different scopes, and different responsibilities. What does an EMT do? EMTs provide basic life support, commonly called BLS care. EMTs are trained to assess patients, manage basic airways, provide CPR, use AEDs, administer oxygen, control bleeding, splint injuries, assist with certain medications, and transport patients safely. EMTs are often the backbone of any EMS system. And honestly, strong EMT skills save lives every single day. EMT training. Most EMT programs are around 150 to 200 hours, depending on the state and program structure. EMT students learn anatomy, physiology, trauma, cardiology, respiratory emergencies, patient assessment, and EMS operations. And one of the most important EMT skills, learning how to assess patients quickly and safely. What does a paramedic do? Now let's talk about paramedics. Paramedics provide advanced life support, or ALS care. Paramedics receive much more extensive medical training. This includes advanced airway management, IV therapy, cardiac monitoring, medication administration, advanced cardiac care, rhythm interpretation, and complex medical decision making. Paramedics manage many of the highest acuity emergencies in EMS. Paramedic education. Paramedic education is much longer and more advanced. Many paramedic programs involve 1,000 to 1,300 hours of classroom, clinical, and field internship training. Students study advanced cardiology, pharmacology, pathophysiology, advanced airway management, and critical care concepts. And honestly, paramedic school is extremely demanding. BLS versus ALS. Now, here's one of the biggest EMS concepts, BLS versus ALS. BLS focuses heavily on foundational patient care, CPR, airway support. Focuses heavily on foundational patient care, CPR, airway support, oxygenation, bleeding control, and stabilization. ALS adds advanced medications, IV access, cardiac interpretation, and advanced interventions. But here's something important. Advanced care does not replace good basic care. Bad BLS with ALS attached is still bad patient care. Common misconceptions. One of the major misconceptions, EMTs are just ambulance drivers. Absolutely false. EMTs are healthcare providers making important patient care decisions constantly. Another misconception, paramedics do everything. Also false. Paramedics still rely heavily on teamwork, EMT support, communication, and strong BLS foundations. Good EMS systems function together. Who should become a paramedic? A lot of new students immediately ask, should I go straight to paramedic? Honestly, strong EMT experience helps many people become better paramedics because EMT experience builds patient interaction, scene management, communication, and assessment skills. And those fundamentals matter. Real EMS thinking. Good EMS providers understand every certification level matters because emergency medicine is about teamwork, professionalism, patient care, and communication, not ego. The best EMS crew works together smoothly regardless of the patch level. Biggest EMT student mistakes. Biggest mistakes students make. Number 1, thinking paramedic automatically means better provider. Number 2, underestimating BLS skills. Number 3, rushing through EMT fundamentals. Number 4, focusing only on skills instead of patient assessment and critical thinking. Assessment drives treatment, always. EMTs and paramedics both play critical roles in emergency medicine. They simply operate at different levels of training and scope of practice. And understanding those differences is one of the foundations of understanding EMS itself. If this video helped, subscribe, because next in this EMS system series, we're covering EMS professionalism, scene safety, medical direction, common EMT student mistakes, and what makes great EMS providers stand out. And those are all major EMT and NREMT concepts.